Welcome to our channel. Today, we are talking about gut health and its critical impact on general health and well-being. From digestion to immunity, the gut, also referred to as the intestine or the digestive system, plays a crucial role in overall well-being. What is your gut feeling? Sharpen your gut instinct to enjoy the everyday benefits of better health. Better still, pay attention and attend to your gut feeling to unleash the power of natural immunity and wellness. Don't forget to subscribe to Joy Fit and Focus channel for more videos. In this video, let us explore the amazing world of gut health and discover how to unlock its full potential. Unbalanced gut and stomach ulcers are more common than you might think. Constipation, diarrhea, fatigue, burning pain, bloating, nausea, etc. can turn everyday meals and living into a real challenge. But what if there was a way to continuously have balanced gut and live ulcer-free? Today, we are diving into the real, science-backed tips to help you prevent unbalanced gut, heal your gut if you have stomach ulcer or related stomach or digestive issues, and keep your digestive system strong and at top function for life. Do you also know that more than 70% of your immune cells and immunity is from your gut? Taking care of your gut health is an important investment in your health and general well-being. Moreover, be aware that colon cancer and stomach cancer are on the rise even in young adults as early as below 20 years of age. These may result from neglected gut health. Prolonged stomach ulcer is one of risk factor for colon cancer, stomach cancer, and other digestive system cancers. Heed the saying, prevention is better than cure. What is gut? The gut, sometimes described as the gastrointestinal tract, GIT, digestive tract, or the intestine, is a continuous, muscular, hollow tube that runs from the mouth to the anus. It is responsible for digesting food, absorbing nutrients and water, and eliminating waste. The gut is the body's powerhouse, where food becomes fuel, immunity is built, and health is maintained. It can be described as the body's core engine. It breaks down food, absorbs nutrients, supports immunity, and even communicates with your brain to keep you healthy and balanced. What happens inside your gut? It all begins the moment you take a drink, food, or anything you consume. Your mouth starts the process, breaking food down with your teeth and saliva. From there, the food travels down the esophagus, reaching the stomach, a powerful chamber where acids and enzymes break the food into smaller particles. Then it moves to the small intestine, the real engine of digestion. Here, nutrients are absorbed into your bloodstream, with help from the liver, pancreas, and gallbladder. Then to the large intestine, where water is absorbed, and beneficial bacteria finish the job by producing vitamins and protecting your body from harmful microbes or germs. Finally, what is left is eliminated as waste, completing one of the most vital cycles in your body. The digestive process keeps you energized, nourished, alive, and protected through immunity. In other words, everything starts in your gut, the body's true powerhouse. It is where food turns into energy, where your immune system is built, and where your overall health begins. A healthy gut means a healthy you. How is the gut balance and gut health maintained? Eat right, eat well, practice good beneficial habitual lifestyle. Food can be your gut's best friend or worst enemy. If you want to maintain balance, prevent ulcer or support ulcer healing, focus on balanced diet and soothing, anti-inflammatory foods that protect the stomach lining. For example, bananas coat the stomach, help balance acidity, and reduce irritation. Cabbage and leafy greens are rich in antioxidants that protect cells. Studies show cabbage juice can help ulcers heal faster. Oats and whole grains are soothing and full of fiber that keeps digestion smooth. They are gentle on digestion and reduce irritation. Honey, especially raw honey, has natural antibacterial properties that may help fight the bacterium, Helicobacter pylori, that cause ulcer. Yogurt has antibacterial property that may hinder or kill Helicobacter pylori. Teas of chamomile, licorice root, or ginger may help calm the stomach and aid digestion. Form the habit of drinking enough good quality water throughout the day. Dehydration can make the stomach acid stronger and irritate your stomach lining or increase the risk of ulcer. Now, let us talk about what not to eat. If you desire to have a balanced and well-functioning gut, an ulcer-free living, or if you want healing from any form of intestinal ulcer, highly reduce or steer clear of the foods that can trigger acid production, increase the risk of ulcer, and delay healing if you already have stomach ulcer. These are spicy, acidic, or fried foods, alcohol and caffeine, carbonated drinks, processed foods and processed meats. Did you also know that although stress may not directly cause ulcers, but it can make the ulcer symptoms much worse? When you are stressed, your body produces more acid and slows digestion. A positive lifestyle for maintaining healthy gut or improving gut healing include avoiding stress and things that cause discomfort. Adopting simple habits like deep breathing, relaxation, short evening walk, being happy, sleep, and being in natural calm and peaceful environment can reduce stress and help your gut relax. Your body repairs itself while you rest, therefore, quality sleep is a very important positive habit. Remember that our goal is not just to treat symptoms, it is to create a gut-friendly lifestyle that supports long-term health. Cultivating 1, 2, or more of these small lifestyle changes can make a big difference. Try these: eat right, eat well, eat at the right time, eat smaller, more frequent meals when needed, instead of overfeeding. Don't lie down immediately after eating. Limit painkillers unless necessary or prescribed. Avoid unnecessary antibiotics intake. Antibiotics affects the population and types of friendly bacteria that help the gut prevent infection. These friendly bacteria help the gut improve digestion. They also help the gut to produce some beneficial vitamins and compounds that your body needs, help with the body's immune functions, amongst many other good things. Quit smoking. Keep track of what triggers your discomfort and avoid or reduce them. Remember to monitor your body or system's reaction to different foods or drinks to detect possible individual allergy or negative reaction. Some examples of gut health and gut function promoting foods include some fruits, vegetables, whole grains, fermented foods with beneficial cultures, etc. Specifically incorporate these to your diet: bananas, asparagus, leeks, spinach, kale, oats, quinoa, brown rice, berries, apples, carrots, beans, lentils, chickpeas, almonds, chia seeds, flax seeds, avocado, ginger, fish rich in omega-3 fatty acids, onions, good quality yogurt, kefir, sauerkraut, fermented cabbage, miso, fermented soybean paste. Don't forget the good habit of observing your food intake to monitor your body or system's reaction to different foods or drinks. That is how you can detect possible individual allergy or negative reaction. Some signs and characteristics of a balanced and healthy gut are: 1. Regular bowel movement. 2. Minimal bloating and gas. 3. No persistent abdominal pain. 4. Efficient digestion with minimal symptoms of heartburn, indigestion, or nausea. 5. Energy and vitality. 6. Strong immune system. 7. Healthy skin is suggested to be linked with gut health. 8. Balanced mood. 9. Diverse beneficial microorganisms in gut microbiome. 10. Good nutrient absorption. 11. Healthy weight. 12. Few or no adverse reactions to foods. What are common indicators or signs that shows your digestive system is out of balance? If you notice several of these signs, it is your gut asking for your attention and a corrective action. 1. Frequent bloating, excessive gas, or cramps after meals. 2. Irregular bowel movements, either constipation or diarrhea. Alternating between the two is a red flag for unbalanced gut. 3. Heartburn, acid reflux, or indigestion. 4. Feeling full too quickly or loss of appetite. 5. Fatigue and low energy. Chronic fatigue can often be traced back to digestive imbalance because when your gut cannot absorb nutrients properly, your energy drops. 6. Brain fog or mood swings. 7. Frequent illness or weak immunity. 70% to 80% of your immune cells resides in your gut. Gut imbalance weakens your immunity and your defense against infection. 8. Skin issues such as acne, eczema, rashes. Toxins from poor digestion can manifest through the skin. 9. Bad breath, halitosis, caused by poor digestion or bacterial overgrowth in the gut or mouth. 10. Unexplained weight gain or weight loss. 11. Sugar cravings or food intolerances. 12. Excess mucus in stool. 13. Poor sleep quality. So how can we stop it and protect your gut lining naturally? Eat balanced meals containing fiber, oily fish rich in omega-3 and lean protein. Eat bananas, sweet potato, brown rice, oats, beans, yam, etc. Eat fruits and vegetables. Drink soothing teas like tea of chamomile flower, peppermint leaves, or licorice root. Drink and eat good quality fermented foods and drinks. Avoid or highly reduce processed foods, alcohol, carbonated drinks, and excessive caffeine. Avoid or reduce the intake of antibiotics and pain relief drugs. Improve hydration. Reduce stress. One health challenge of the gut or digestive system is ulcer. Gut ulcers, also called gastrointestinal ulcers or peptic ulcers, are sores that develop in the lining of the digestive tract because of erosion by stomach acid and digestive enzymes. An ulcer is basically a wound or an open sore that develops in the lining of the stomach or small intestine. It may be caused by gut acids, a bacterium called Helicobacter pylori, or by overuse of painkillers like ibuprofen and aspirin. When your stomach's natural protective layer breaks down, acid starts to eat away at the tissue. That is when the burning pain, indigestion, or sometimes vomiting can begin. The different type of gut ulcers includes 1. Gastrointestinal ulcers. These are ulcers that occur anywhere in the gastrointestinal tract, including the esophagus, stomach, small intestine, and large intestine. 2. Gastric ulcer. A gastric ulcer is a type of peptic ulcer that occurs in the stomach lining. Symptoms may be pain worsening after eating, because food triggers acid release, nausea, or bloating. 3. Duodenal ulcer is an ulcer that occurs in the duodenum, the first part of the small intestine. Symptoms may be pain improving after eating but returns a few hours later, often at night. 3. Peptic ulcer disease, PUD, are ulcers that occur in the stomach or duodenum due to stomach acid and digestive enzymes. 4. Esophageal ulcer occur in the lower esophagus, the food pipe. It is usually caused by acid reflux, gastroesophageal reflux disease, GERD, or medications. Symptoms are burning pain in chest, difficulty swallowing. 4. NSAID-induced ulcers means ulcers caused by long-term use of non-steroidal anti-inflammatory drug, NSAID, such as ibuprofen or aspirin. 5. Helicobacter pylori ulcers are ulcers caused by Helicobacter pylori, a bacterial infection that damages the stomach lining. 6. Stress-induced ulcers occur due to physical stress, such as severe illness, injury, or surgery. What can cause stomach ulcer? Poor diet, stress and anxiety, antibiotics and other medications, lack of sleep and exercise, environmental toxins. Common symptoms of a stomach ulcer include 1. Burning pain in the stomach area, usually felt between the chest and belly button. Often worse when your stomach is empty, like at night or between meals. The pain at times may improve after eating or taking antacids, but not always. 2. Bloating or feeling full quickly. You might feel bloated after small meals or experience frequent belching. 3. Nausea or vomiting. 4. Indigestion and heartburn. This is a burning feeling in your chest or upper abdomen, sometimes mistaken for acid reflux. 5. Loss of appetite. 6. Unintentional weight loss. 7. Dark, tarry stools is a sign of internal bleeding. This is regarded as a medical emergency. 8. Fatigue or weakness, which can happen if an ulcer is bleeding slowly over time, leading to anemia. More serious symptoms that are not very common symptoms are persistent vomiting or trouble eating, sharp, sudden, and severe stomach pain, vomiting blood or material that looks like coffee grounds, fainting or feeling lightheaded. Note that ulcer symptoms can be mild or not noticeable in some people, especially those taking painkillers, like ibuprofen. Be very observant. Be vigilant. Ulcer presents in stages as listed below. Stage 1. Gastric irritation is the pre-ulcer stage. The stomach lining becomes inflamed or irritated. The protective mucus barrier starts to weaken, but no open sore yet. Common symptoms are mild heartburn, bloating, or discomfort after meals, slight nausea or belching, burning feeling when stomach is empty. Stage 2. Erosion, surface damage. At this stage, acid begins to erode the top layer of the stomach. Small superficial wounds appear, but have not yet penetrated deeply. The symptoms are stronger, more frequent stomach pain, burning between meals or at night, relief after eating or after taking antacids, occasional nausea or acid reflux. Stage 3. Active ulcer with open sore formation. At this stage, the erosion deepens into the muscle layer, forming a visible ulcer or open wound. The tissue becomes inflamed, painful, and vulnerable to bleeding. The symptoms can be persistent, burning stomach pain, pain when the stomach is empty, or relief briefly after eating, nausea, poor appetite, fatigue. In some cases, vomiting or dark stools if bleeding starts. Without treatment, it can progress to serious complications. Stage 4 is the complicated ulcer with severe damage. The ulcer penetrates deeper or leads to other dangerous issues such as 1. Bleeding ulcer which damages blood vessels causing vomiting of blood or black stools. 2. Perforated ulcer that creates a hole in the stomach and intestinal wall leading to infection. 3. Penetrating ulcer which extends into nearby organs like pancreas and liver. 4. Obstructing ulcer occurring with swelling and scarring, may blocks food passage leading to vomiting, weight loss. Symptoms may include sudden, severe stomach pain, vomiting blood or material that looks like coffee grounds or dark brown, black stools, weakness, dizziness, or fainting. These are medical emergencies requiring urgent health care or in some cases surgery. Maintaining a balanced gut or living ulcer-free is not just about avoiding pain, it is about nurturing your gut so that it can support your overall health and energy. When you eat right and eat well, manage stress, listen to your body, and do the right thing, your gut, your digestive system, can truly stay healthy, perform very well, function optimally, and serve you well. Diets are natural ways of management or interventions that at times may take long application time. But they are usually safe and very rewarding. Note: this video is for information purposes only. It is not a substitute for professional medical consultation when needed. Use the comment icon to make your comment, contribution, suggestions, or ask your questions. Or send direct email to joyfitfocused@gmail.com. Thank you for watching. If you found this video helpful, don't forget to give it a thumbs up and share it to someone who has been struggling with stomach issues, or someone who needs it. Remember to subscribe to Joy Fit and Focused channel for more valuable content. Here is to a balanced, calm gut, ulcer-free living, and a healthier you.